My name is Stephen I. Esses. I'm a board-certified orthopedic surgeon. I'm a subspecialist in the field of spinal disorders and spine surgery. I'm board-certified by the American Board of Orthopedic Surgeons, by the American Board of Spine Surgeons, and am board-certified by the Quality Assurance Utilization Review Committee. Although I was born in New York, I was raised in Toronto, Canada. I did my undergraduate work at medical school at the University of Toronto, did my orthopedic surgery training at the University of Toronto. By the time I had become an orthopedic surgeon, I had made the decision that I wanted to be a subspecialist in the field of spine surgery and spinal disorders. I did 1 year at Harvard in Boston, and I spent 1 year as a McLaughlin Fellow. A McLaughlin Fellowship affords one the opportunity of traveling anywhere in the world for 1 year, as long as they commit themselves to teaching at a university for 3 years afterwards. I spent 6 months studying spine surgery in the Far East. At that time, they were developing anterior spinal approaches for the treatment of tuberculosis. I spent 3 months in France studying scoliosis surgery with Cottrell Dubussé, and then spent 3 months in England where they were just beginning to use endoscopic techniques and microsurgical techniques. I think seeing people satisfied with surgery, being able to help them, being able to change really the course of their lives. Patients that have had chronic pain can have an operation and be relieved of that. My favorite part about my job is seeing patients satisfied and pain-free. Nerve pain is the worst type of pain that you can imagine, and being able to relieve that pain is life-changing for many individuals. So my philosophy is to treat patients the way I would like my family members to be treated. That means that patients that I operate on have my cell phone number. I phone those patients routinely to check on them, the same way as you would your brother and sister. So everybody's concerned if they're contemplating surgery. I think the most important thing is for the patient to have a very realistic expectation of what's going to happen post-operatively. All too often I see patients who have been advised to have surgery who think that they're going to be back at work or doing sports 10 days thereafter. In many instances, that's not realistic. So I sit down with patients before surgery, reassure them about the type of surgery that they're going to have, and give them a good idea of what to expect following surgery. That way that there's no surprises. One of the things that I recall vividly is in my first year of practice being called to the hospital at about 2 o'clock in the morning to see a teenage girl who had been involved in a very serious car accident. She was paraplegic and had a very serious fracture dislocation of the spine. I did surgery for about 3 hours, waited in the recovery room until she started to wake up, and it was immediately apparent that she could move her legs now, that she had sensation in her legs. I remember walking from the hospital back to my apartment at about 5 o'clock or 6 o'clock in the morning, thinking to myself, there's nothing more that I'd rather do than what I just did, and it wouldn't make a difference if I got paid or not. When you come to see Dr. Esses, you'll see Dr. Esses. I'll sit down with you, talk about what's been going on, examine you myself, look over all of your images myself, not rely on reports, and then you and I can have a conversation about what is best for you.